Hello, class. My name is Marshall Lothry Davis, and it's a pleasure to be able to present my research this week on contemporary theory assignment. And my assignment is on forgiveness therapy. Now, as you can see that there are four different phases for forgiveness therapy that I noticed throughout the articles. The first phase is of forgiveness is the uncovering phase. This is where you can improve the understanding of the abuse and how it has affected their life. In the second phase, which is the decision phase, this is where you can experience or they can experience a deeper understanding of forgiveness and decide if they will accept it or reject the forgiveness. Now, in the third phase, which is the work phase, this phase is where a deeper understanding of the offender um, is implemented, and this can lead the clients into um, a positive emotion towards the offender as well as the self. I did notice the last two steps, which would be the work phase as well as the deepening phase, is where the therapist they really take their time in spending that one-on-one empathetic, um, just a lot of care is in these last two phases. Now the last phase, which is the deepening phase. Now in the last phase, this is where negative emotions towards the offender lessens even more by the client, thus allowing themselves to find meaning in the experiences and discovering ways that they have grown through uh, they have grown as a result, and they have also realized that how they have persevered through the negative things in their life. Now, on the second question, it says, what causes dysfunction in the theory's view? Well, from researching the articles that I did read, I kind of, or what I read, I kind of just grouped some things together that I noticed a repetitive pattern. One of the dysfunctions that I found is that, you know, how every therapist wants to build off of the next model, the next theory. So I just really was kind of confused on some of the lingo that was going on and had to review it. But I just said every therapist have their own definition on forgiveness as a meaning itself, as well as anger. You know, every therapist had an opinion on the client's anger or behavior on how they should approach forgiveness. I also noticed the stages. There are a lot of therapists that they have different stages, in which promotes a process for the clients to follow. So I just found like a lot of the studies had so many different steps to the process that it kind of it got overwhelming to me just by being a reader. Um, the second main dysfunction that I found was the therapeutic effects. I really didn't kind of I understood where they were going, but I still was a little confused because the articles that I reviewed ended with the same conclusion, which stated that forgiveness therapy was in fact beneficial in forgiveness therapy groups, but needed more research in comparing to other controlled groups. So, what I found is that when they put forgiveness therapy against a controlled group, um, it talked a little bit about the control group, but it kind of centered more about the forgiveness therapy group. And then it led me to think like, okay, so in this forgiveness therapy group, you know, what were the main subjects? Was it the same as the control group? Some of it was yes, and then some of it was no. So again, I'm new in this area, but I found it a little confusing. So that was the dysfunction. I would, you know, I got the same thing at the end. I was like, well, You know, did it work better? Yes, it did, but there was always a but. Um, the next section, which is number 3, is what's the nature of therapy for this model. Now, the nature of forgiveness therapy that I researched in the articles was the decision to overcome pain that was inflicted by another person. It was also letting go of anger, resentment, shame, and other emotions associated with the injustice, even though they are reasonable feelings. And treating the offender with compassion, even though they are not entitled to it. So that seemed to be the theme of the forgiveness. They usually started out that even though forgiveness, they really wanted to make sure that they did not mislead the readers, and wanted them to know that even though forgiveness was going to be taught, they wanted to make sure that readers as well as the clients know that um, what they were feeling were real feelings. So I really did feel the empathy when it came um, to that. Now, number 4, which is the role of assessment. The role of assessment for me, self-assessments in the articles were implemented before the sessions for placement as well as after to check on the progress of the client. I usually at the beginning of the articles, it did tell that assessments were taking. Um, I'm thinking that the assessments were written on paper, and then they were already came in with a diagnosis. Because most of the forgiveness therapy I read about was with fear, shame, guilt, anxiety, depression. Um, there was an article that I did read about sexual abuse, and another one on infidelity. So a lot of the articles they had where they were giving um, assessments for the clients to take home for homework assignments. Or I read a lot about a homework assignment. So I know that these were pre and post self assessments. Now, the role of the client and the counselor. Um, like I said, during the articles, I did get a form of empathy when I did read, but I also noticed um, the wording on the article that's mindfulness based, which was forgiveness therapy among women affected by infidelity. Now, I did read that this writing was way passive, as far as another article that I read that was like forgiveness therapy for the promotion of mental well-being. I just noticed the different wording, and I did find that the therapists in the the women where they were affected by infidelity, you could just tell the passiveness and the empathy, whereas they were more caring, more non-directive as far as just kind of coasting and being there for the women. Whereas far as in this article, it was basically take this test, do this homework, this is what we found. But I found out, even reading through forgiveness therapy, there is a degree of empathy that is needed, because dependent on what you are really dealing with, as far as with the clients, you have to make sure that you are getting on their level, so that way you can build a rapport. So you do have to watch everything that you're doing, because we're working with hurt individuals. So I know for forgiveness therapy, there's so much that we are asking them to do. So making sure that we are giving them that time to for self-awareness is going to be very important. It says what personal qualities in the client will help the client take a role that will help the therapy be successful. A lot of the articles that I read, the clients who had the most success were the clients that came prepared. Even if they did have a bad day, they still came prepared. They were they were on time. They engaged. They even helped like other other clients. And I thought that to be very awesome how they did also show the difference in both of the all three of the articles that I read, the difference between the clients that were engaging and the clients that pretty much engaged sometimes versus the clients that just did the homework when they got there, didn't even do it at home. Now the goals of the therapy is, it asks what is therapy trying to accomplish. So for this, the goals of forgiveness therapy that I found is, the goal of forgiveness therapy is trying to get the clients to accomplish forgiveness towards their offenders and themselves so they can live a carefree life without shame, guilt, and interpersonal help. Another goal that I took is, the goal is to bring awareness to the client on how they feel about what happened and be able to articulate what about the situation is not okay. Another is to make a commitment to yourself to feel better. Also, to help the client understand that forgiveness does not mean reconciling with the offender. That was a big thing that I read in forgiveness therapy, especially when you're dealing with women who have been in domestic violence. Um, Another important goal was get the right perspective on what is happening. Therapists have to be there. You have to be there in every moment because they need our help, especially with the forgiveness therapy. And I just found it especially reading this was very near and dear to my heart because I've been through forgiveness therapy. Now, examples and techniques. Now, process based with the techniques that I read about. Again, there was so much information. This is what I pulled that stuck out to me. So the process-based models was prompted by Enright and the Human Development Study Group, 1996, that focused on four key phases, which included cognitive, affective, and behavioral elements. Now, as you can see, process-based, which was the reach model and cognitive reframing. And then there was decision based, which was defining forgiveness and heart focused meditation. Now, the reach is, the acronym is, R is recall the hurt, E is develop empathy for the offender, A is consider forgiveness as an altruistic gift for the offender, C is make the commitment to forgive, H is to hold onto the forgiveness in times of difficulty. As far as the decision-based interventions, and in this one, this was developed by McCullen and Worthington in 1995. So the decision-based intervention used to define forgiveness by using positive and negative visualizations related to the issue. So within that one, they also flip back over on the other side, which would be process based, would be cognitive reframing, which is used to see the offender in a new light. Whereas it came from, again, decision based, would be heart focused meditation. Now, this is the meditation that brings awareness to the negative health risks from holding grudges. Now, on one of these, which was about the techniques, I wanted to really talk today about one of the cases that I did read about. Again, I read so many articles, and again, I was so confused. And this was basically primarily the example of a forgiveness therapy. I really liked this article a lot. um, I like how they presented forgiveness therapy, and I like how they implemented it. And this came from forgiveness therapy for the promotion of mental well-being. And Um, this case study ended with a conclusion that stated that there is a need to identify effective methods for improving the mental well-being of the group. Um, it says this review provides moderate quality evidence indicating that process-based forgiveness interventions are effective in improving mental well-being following a range of significant hurts among diverse population groups. I kind of liked how they honed that out because we have to be so culturally aware of our clients and how we approach them. And I just loved how in this article it really separated and made sure that we as therapists didn't forget to include our clients' age, our clients' ethnicity, our clients' diverse, what they believe in, even to how we sit and how we engaged. So, in this case study, I did find that they did provide a lot of positive reinforcement towards trauma, violence, and abuse, and did say that forgiveness therapy, um, it it was a positive factor when it came to helping the clients. Now, on this one, it says to critique of the theory, how well supported is this theory? Um, I think, as everyone said, it still needs to be researched. But more and more is coming out, and I love how Christian worldview is being implemented as far as when it becomes forgiveness. I don't like when the secular world comes up with forgiveness and forget that that's biblical based about forgiveness, and this is where the foundations come in. So it does my heart good to even read this week on some of the articles about forgiveness in the Christian worldview. So, what aspects of the therapy need further research? I would like to see more about the other groups and what are they given the same curriculum as far as the forgiveness therapy, and are they engaged in the same way? I would like to see that. How well does the theory address faith and cultural? It doesn't. I didn't read anything from these secular articles that even spoke about Christian worldview at all. I mean, one came about, it said something about religion, and if you're religious, make sure you incorporate it, but that was it. Um, and maybe that's all they can say. But I would like to see a little bit more. I would like to not see a little. I would like to see a lot more about Christian worldview bought into this theory. Now it says, how compatible is this theory to a Christian worldview? It's very compatible. Um, as you can see on my last slide, foundational scriptures. Forgiveness is a choice we make. It's a decision of our will, motivated by obedience to God and His command to forgive. The Bible instructs us to forgive as the Lord forgives us. Bear with each other and forgive whatever grievances you may have against one another. Forgive as the Lord forgave you. I got that strictly from the Word. We have so many scriptures, foundational scriptures on forgiveness. And this one's Ephesians 4:31 through 32. Get rid of all bitterness, rage, and anger, brawling and slander, along with every form of malice. Be kind and compassionate to one another, forgiving each other, just as in Christ God forgave you. I have really enjoyed researching this, and I can't wait to further my study on forgiveness therapy. Thank you so much for tuning in. Be blessed.